Oh, thank you. So it's been great to be part of, and I hope you enjoy the session today. This is kind of a series of sort of modules that Hilal will go through in a minute, but the first module is today and tomorrow, and like I say, very glad to be part of it. And I hope that this will be a series of kind of events that we carry forward. And we want your feedback after each of these sessions, because that's really, really important, just to drive the quality of our engagement and our sessions as well. So welcome everyone, really delighted to have you here, and I value your time and expertise with the wider audience, and I hope you find the session helpful. So thank you. Back to you, Hilal.
Thank you very much, dear Mumtaz. We have to stick to times. I have certain ground rules, please. I will go through the aims and objectives of this course, and then the ground rule to be followed during this meeting. There is enough time for discussion and to discuss your ideas and suggestions. But please, before that, you have to raise your hand, and Omnia will moderate everything, and we will summarize the things to you. I will go first, and I will share what are the idea of this course and what we want by doing this course. After the establishment of our network under the umbrella of the Royal College of London, we decided to have certain activities in 3 domains. One of them is the medical education. The second one was that in medical training initiative, and that was a training program in UK. And the third thing was that scientific activity, including a course of doing medical research projects. This course of medical education, we are believer that a good health service provision needs a good medical education and clinical training. I usually say that the medical schools are factories and the products are the doctors. The doctors should match the need of the society, and therefore if they are trained well, they will be a good doctor for the future. And therefore this basic course in medical education were mainly directed to undergraduate students, but also it might be of help to any other working in learning and teaching process at other levels, from the newly graduate to postgraduate trainee and to a faculty member like me. But the main target audience are the undergraduate students, because we are a believer that the leaders of tomorrow should be prepared today. And this is a very important one. This medical education course consists of 6 modules. I hope the sharing is clear for all. Okay. Module 1, which are addressing today and tomorrow, why medical education. Module 2 will be about learning. Module 3 will be about what is expected from a good teacher. And Module 4, how about students learn effectively. And Module 5, how can training be organized in the curriculum. And the Module 6 about assessment. 12 distinguished professors and consultants from UK, from South Africa, from Iraq are going to deliver these module to you. We choose to deliver the module over 2 days, Friday and Saturday, so that it will not be a burden for medical students, because they have to prepare their sessions and examination, etc. Today, Professor Mumtaz will talk about the importance of medical education. Myself, I am Hilal Safar, will talk about the history of development in medical education. For tomorrow, Dr. Sabih al-Mishhadani and Dr. Sahar Abdul Rasul will have talked about a literature review and about medical professionalism. The course also are produced by other professors, distinguished professors. We will introduce them to you as they are approaching their module time. Today, just going through the agenda of today, after my brief description about the course, Dr. Mumtaz will talk about the importance of medical education for about 30 minutes, and then we will have discussion for 15 minutes. 10 minutes break, and then I will present historical review of changes in medical education for 30 minutes. After that, we will have discussion. I have to remind you that you have to raise your hand before saying whatever you want to say. Otherwise, you can text your question in the text message bar, and it will be gathered by Omnia, and then she will ask the speakers. In this course, we will have an active learning, and therefore there will be an assignment. The assignment have to be completed from each participant, as well as feedback form. And these are two important requirements in order to certify the completion of the course by any attendee. Thank you very much for your participation, and hope we are doing something good for you. We are putting the seeds on the ground, and you are the big trees of the future. Thank you very much. Mumtaz, I will stop sharing, and now the floor is yours, Mumtaz.
Thank you, Hilal. I'll just share my screen, if I may. Are you able to see that okay, Hilal?
Yeah, that's okay. Yeah,
brilliant.
Seems okay.
Okay. So thank you, Hilal, for that kind introduction, and we'll make a start on our course today. So my talk is around the importance of medical education, to give you an overview of, kind of why we're here today and why is it important as part of our journey to be understanding and learning more so about medical education. So as Hilal mentioned, I'm the FRCP Global Vice President, but as part of my other roles, I work as a consultant nephrologist in Manchester in the northwest of England. And I also work as a Postgraduate Associate Dean for Health Education England. And I also have undergraduate university roles as well as Deputy Director of Conduct and Progress, as I have an interest in professionalism. So a bit of a wide portfolio, so hopefully it will give you some context as well. So what do I intend to cover today? So my learning outcomes for this session, so I'm hoping that by the end of my session, you'll be able to understand and recognize the importance of medical education. Hopefully understand the definitions and some of the key concepts around medical education, and importantly, acknowledge its purpose, its impact on professional development, and more importantly, on patient-centered care. Within my different roles over the years, I've done a lot of work around medical education standards and quality assurance frameworks. So I want you to kind of learn a little bit around that, of the awareness of that and the importance of that. And then finally, something that's been very, very important in my educational journey as well, I thought is important to just bring forwards the importance of role modeling in medical education and how that can shape careers, and certainly it's shaped mine over the years as well. So starting off, what does medical education mean to you? So like any definition or, kind of any concept, it means different things to different people. So to myself, I guess medical education starts right from the outset, from school to undergraduate medicine to then postgraduate medicine, and then the continuous learning that you have as a physician, as a doctor, up till retirement and even beyond. And then there's the different methods of learning, whether that's rote learning through books and textbooks and things. And I think COVID has opened so many opportunities of more kind of blended and virtual learning opportunities as well. So I think it's more of a continuous process in my mind, but just to give you a little bit an overview of where I think it kind of sits. And my view very much strongly is that the medical education should be seen as a continuum. It's not just about undergraduate medical education. It's not just about postgraduate medical education. And a lot of my work crosses boundaries, crosses both the undergraduate and postgraduate world, but also across different institutions, because having that collaborative approach is really important, and cross-organizational approach is really important as well. So when you look at definitions, there's hundreds of them, and there's different kind of emphasis on different definitions. But one of the ones I found, I thought encompasses some of the things that I think are important when it comes to the concept of medical education. So provision of instruction and information from the basic science side into medicine and then into clinical practice, because it's that integration which is really important. and ideally in such a way that it kind of inspires the recipient for that desire of learning and spontaneously going through that continuous learning throughout your life. And, you know, kind of, I guess the whole topic of mine is the importance of medical education. And why is it important? Well, it's essential, absolutely crucial for good medical practice. And what does being a good doctor mean? So we know that, you know, being a good doctor is more than the knowledge, skills, attributes. It's the wider performance and things. And this is given that I'm UK based. Some of my sort of slides and things are sort of a little bit more UK based, but I think would be relevant to all. So the GMC, the General Medical Council here in the UK, is our regulator, and they set out our standards. So the Good Medical Practice Framework, which was published some years ago, gives you a kind of an overview of, you know, setting the standards of what makes a good doctor. And the domains and attributes required from an individual are shown here. And I think it's really important to understand it's beyond that, just the knowledge and skills and, you know, kind of what you learn from a book. It's your wider performance. It's the impact on safety, quality, communication, the art of communication. I think I always say to my junior doctors, you could be the brightest person with all the knowledge and skills, but if you can't communicate that to patients, if you can't establish a rapport with your patients, then you're not going to go very far. So this kind of encompasses more of a framework. So knowledge, skills, performance in domain 1 is around maintaining your professional performance lifelong. The safety and quality, patients at the center and heart of all of what we do. So again, effective systems, how to protect patients. And these all things are important when it comes to curricular design, both for undergraduates and postgraduates, because we need to encompass things like patient safety, things like risk management and broader system issues as well. Communication, I've mentioned, team working, building partnerships, and then maintaining trust, because trust, integrity, those softer skills, as we call, are probably more essential, sometimes I feel personally, for patient, you know, kind of relationships and building those kind of strong, you know, kind of foundations to build that patient-centered care. So when you think about key concepts around medical education, what's important? So I think that, you know, kind of medical education, as I've mentioned, is a much more of a dynamic process. It commences at the start of basic medical education, or even prior to that, from, you know, kind of school, when you're high school, when you're preparing for all the different things that you need to do to get into medical school in the first sense. And it continues lifelong until a, you know, physician retires, or even beyond. I think those skills don't go away. And what does it consist of? So training aimed at, you know, physicians or wider doctors in acquiring these competencies, these skills, behaviors that allows you to practice in a professional manner, but ethically at the highest level of integrity. And whose responsibility is it for medical education? I think one could argue that it's everyone's responsibility. All physicians, doctors, wider healthcare professionals, the medical faculties, the educational institutions, whether it's the higher education institutions or whether it's in the postgraduate settings as well. And government and regulators should share the responsibility for guaranteeing that the medical education meets the highest quality standards. And that is something that's maintained in a continual fashion. So it's not just about designing a curriculum and leaving it there. It's that continual process of evaluation, making sure that's quality control, quality management and assurance is there as well. So what are the different levels around medical education and training? So I thought this was quite useful, and I can talk through even my journey in medical education over the years. So I guess if you start at the top in the red circle around the undergraduate curricula, so I know today there's a number of you as medical students, but there's a number of you who are in much senior grades as well. So certainly my journey started in Manchester, where I am based now too. And I was a medical student in Manchester, gosh, back in the 90s, showing my age. And I graduated in Manchester in the late 90s. And then my immediate postgraduate training was also in Manchester. So you do your foundation training In the time I was doing it, it was only 1 year, 6 months of medicine, 6 months of surgery. Now the foundation program is over 2 years. Then you do your core medical training or core specialty training in whatever you want to do for 2 to 3 years, and then 5 years of specialty training, within which I also did my PhD research, which was on basic science, lupus, nephritis, and genetics of that. So here in the UK, you can take time out of program to do research as well. So you've got academic, sort of further qualifications within your postgraduate training. And then it leads to the physician certification. So here we get a certificate of completion of training, RCCT, after which you can apply for a consultant job. And then that's when I got my renal consultant job. But the importance around physician certification and everything that you do in your postgraduate training is, very important, because it influences the quality of care. And there's a lot of evidence to show that quality of training influences quality of care. So if we train our medical students, if we train our junior doctors better, the patient care will be better, and that will obviously improve their outcomes as well, which is extremely important. And then going on to professional recognition. So over time, you develop your respect, your integrity, your recognition within your roles. And in my case, achieving the consultant position was one part of the journey, but I continued doing different things. So my medical education qualification, which was my MSc, my Master's in Medical Education, was as a consultant. Because I was doing more and more educational roles, both as a Royal College tutor, as a divisional lead, as a training program director, I felt that it was really important for me to have a qualification within education. So then I did my Master's in Medical Education. My thesis was around workplace-based assessments, and it's demonstrating that continuing medical education, which is essential for appraisal and revalidation. So that's kind of like as a continuous journey. And then going into academic leadership, that could be in different ways. But for me, as I mentioned before, I have undergraduate roles and also postgraduate roles as an associate dean and things. And that a lot of that is around quality management, around training and training programs. And the senior management, you could do management within your hospital, you could do management, educational management. So a lot of my roles are more around educational management, both on a local level, regional level, and then now with the Royal College role on a wider kind of global scale as well. So, and all in all, as I'm teaching you today, it goes round in a full circle. I think medical education allows that educational career to give back something to our students. And I think that is something I'm very proud to be part of. And as Hilal was saying, you are the seeds, you feel like you're sort of sowing the seeds for you to grow, to become the future leaders. And that is a really lovely circle to kind of feel as though that you're part of as well. So that just gives you an overview of where people can take their educational sort of qualifications and educational journey. But like I say, demonstrates the different levels where medical education and training can come into play. So going into the journey of a learner. So where does that start? Where does that end? And again, you will see a theme in my talk. A lot of it is circular, like a circle. The learning never ends. You go round in circles, but you learn more, you acquire more, and you hopefully grow more as an individual, as a physician, as an educator as well. So if you start on the sort of top right-hand side, where it says naive, that's where you start off, I suspect, in the unconscious incompetence. What I don't know. You're just starting off learning that process of discovery, that learning, the building blocks, the foundation of your learning as well. And then that level of conscious incompetence, probably when I was at medical school, I know what I don't know. I know what I need to learn. And I have a plan of how to get there. And the plan of how to get there is, sort of now my role as a supervisor, as a supporter, as a mentor, to hopefully support my individual students and trainees. And then going on to the conscious competence, which is, I know what I don't know, and it's how that is put into practice and how you build on that. And then it's great when you get to the stage where that unconscious competence happens, that it becomes second nature, and you just do it as part of, kind of your own routine, what you've built in. But that reflection and the reflective competence continues, because I still now, 20 plus years since I qualified, 15 years since I've been a consultant, you still have that element of doubt, that element of, I need to learn more, I need to check, I need to make sure. And that's absolutely fine, because that process of learning is still there. And I never, ever feel that I could not ask anybody else, because I think, like any individual, nobody knows everything. So we should be asking and learning with that reflective process. So I think an ongoing process as far as a journey as a learner. And then going on to curricula, I know Hilal's going to discuss more of the historical sort of development of medical education. So purposefully, I didn't cover all the historical landmarks of all the different developments. But I thought it's important to bring forward the curriculum, what that is, and some of the kind of different iterations over the years. So the curriculum can be seen as an expression of educational beliefs and practice, and it's the whole educative process. And even in my time, I've seen different curricula and principles. So a lot of my learning was very much rope learning in my medical school, preclinical, clinical years, big didactic lectures, 200 to 300 people, one of the biggest medical schools in Manchester, where we have 300 students intake per year. So 1,500, 1,800 students in the medical school. So very much didactic learning, and problem-based learning only started when I was qualifying, finishing medical school. But now what I teach is very different. So it's much more of an integrated curriculum, a spiral curriculum, much more dynamic, future-orientated, patient-orientated, discussion around systems, integrated primary, secondary care. So there's much more integration of the curriculum into practice, which I think is really, really important. And how do you learn? So I think there's been so much change over the years of how the curriculum has developed, but also how the curriculum is taught and how it's assessed as well. So moving from just textbooks and, learning from books and content, I think there's much more different ways of learning now, and the blended learning, the case-based discussions and things, so much more wider, and not just about knowledge and skills, that behavior, that principles, that wider, kind of professionalism, communication, the art of medicine. I think those softer skills are so very important, and hopefully the curriculum, certainly in my lifetime, seems to have changed to a more positive kind of outlook as well. And here within the UK, this was something I was part of. So one of my other roles is working with the GMC on professionalism matters with the General Medical Council. So we developed, wider pieces of work around the generic professional capabilities. So this came out back in about 2017-18 time. And this is basically saying that as a good doctor, in the core is the knowledge, skills, the professional values and behaviors. That is core of what a good doctor should be, and what we should be encouraging within our curriculum to develop for the medical students as well. But in addition to that, what are the other important things? So research and scholarship, which is what I lead on in my postgraduate associate dean role. That's one of my portfolio responsibilities. Education and training. So making, sort of, and investing in our students to develop them into future leaders, future educators, which is what we're doing here today with our students and with our colleagues. And then patient quality improvement, all should be at heart of what we do. That leadership, team working skills, instilling that early, not waiting for becoming a manager and becoming a leader to have leadership training, giving that and promoting that early. And health promotion, illness prevention. So it's not just about learning about basic science about how illness happens. It's around illness prevention, health promotion, to try and avoid these things happening. So I think this is quite a good framework to have. And all of our curricula now, both in undergraduate as well as in the postgraduate setting, have this framework. So whenever a new curriculum is designed, it has to show that these things are covered and mapped to the new curriculum domains as well. So it's very important, and it makes you remember and not forget some of these important aspects of the capabilities that I think, kind of doctors should have over time. And this is just an example of capabilities in practice. So the way forwards now is the concept of entrustment, or EPA's entrustment professional activities, which goes even one step beyond workplace-based assessments. So this is going down to being a judgment being made of an individual of whether they are capable of doing a particular task. So this is the internal medicine curriculum decision aid, which shows the clinical capabilities there, 1 to 8, and basically at the different levels of training, whether you are achieving this. So your supervisor would be making a judgment to say if you are able to progress onto the next stage. And this would be made on the knowledge, skills, behavior, the workplace-based assessment, the other assessment tools, but then finally a judgment is made on capability, which I think is moving things in the right direction. So a lot of assessment methods have changed over the years, from very little to lots. And I think this going back to judgment with evidence is really important for progression. So that's just moving the journey along. And how do we support the learner? So as I mentioned, the curriculum is the core of learning. But here, and I'm sure yourselves in Iraq as well, the portfolio, whether it's an electronic record or a paper record, is really important to encompass and encapsulate the learning sort of content, as well as the progression as well. So if you start on the left, the learning happens, the appraisal, which would be the regular meetings with your supervisors, in which you set your objectives, then you develop your personal development plan, which is then tailored. So there's a lot of talk in medical education around individualized learning, personalized learning, which again, I think is a really important tool because everybody learns differently. So I think investing in that individual to make a plan to suit them is really important. And then that regular assessment with feedback. Now, feedback, is really important to see where the gaps are in learning and then give targeted feedback such that those gaps can then be narrowed. And feedback is around developing insight. So it can be done constructively, and then to develop that insight to drive the learning. And then that's that continuous loop that happens to hopefully support the learner to progress and achieve their learned outcomes. And then just going through some of the other principles of learning. So you may well have come across the Miller's pyramid of clinical competence. And this is more frameworks around how you measure clinical competence. So in the years gone by, again, even in my time of assessment at medical school, it was all about multiple choice questions, essays, very much describe the anatomy of the hand, describe. So very much fact gathering, rote learning, traditional methods of learning. But it's the interpretation and the application is what you want. We're all synthesizing information as clinicians, and that's what you want to assess. So that's the know-how of those case-based discussion assessments. And then that demonstration of learning, so OSCEs were just coming into play when I was at medical school, and now I examine. Only last week I was examining for our medical student exams, and that shows demonstrating learning. And then the workplace-based assessments is where that's the top of the pyramid, where your performance is integrated into practice. And that's the does, and that is what's hopefully then going to be driving that learning process even further. And you can look at it from a different way. So this is the Bloom's taxonomy, which is again the hierarchy of learning. But what you want is, your medical students or your trainees to be right at the top, but it takes time. So you need to start with the remembering of the facts and the understanding, but then it's the application, the analysis, that decision-making, the understanding of complexity, all these things around, clinical decision-making. Certainly all those things were not overtly taught when I was a student, but I invest a lot of time in teaching those things now because you want your sort of learners to be at that higher level of thinking and, in that synthesis of wider evaluation to hopefully drive patient care. All this is about optimizing patient-centered care and the quality of how we train will improve how we care for our patients and their outcomes as well. So I think over the last few slides, I've talked about a lot of changes. So again, Hilal will probably touch on this when he goes through more of the historical changes over the years. But just as an overview, there's been significant changes over the years. And this big move from didactic learning, certainly that's how I was taught in my days in medical school, to that problem-based learning. Again, lots of issues around problem-based learning. There's nothing perfect about different systems. So I think a blend of different ways is important, to now much more case-based learning, which I think is a really good way of integrating learning. Much more emphasis on that integrating learning, the systems, the competency-based learning, which again, I'm sure Hilal will talk about in a little bit more detail. And then around methods of assessment. So that's changed over the years from the traditional essays and MCQs to kind of much more wider on-the-job assessments around workplace-based assessments, as well as the entrustment professional activities that I talked about as well. A much greater focus on professionalism, which I think is key. So a lot of work that I do is around professional behaviors and how we can identify, kind of particularly unprofessional behavior early, but also how we can promote more positive professionalism going forwards, because that's at the heart of what I feel makes a good doctor. And then that focus on those wider generic professionals capabilities that I discussed before. And there's a real emphasis on the impact of the educational environment. So you could be in the best medical school, for knowledge base and whatnot, but if the environment or that, sort of whether it's a hospital or your institution isn't driving learning, then that can compromise people's learning. So there should be a focus from our side now within positions of, kind of influence, where we're making that educational environment very supportive to drive that learning. And more so recently now, certainly I'm very much involved recognizing the importance of students and trainee well-being. The levels of burnout are huge. The levels of people leaving medicine are so high, certainly in the UK, as well as I'm sure elsewhere. And it's so important to look after our students and their trainee well-being to provide that support early, because if that support is provided early, we know that, sort of they'll stay on in medicine, but also their own progression will not be compromised. So it's really, really important. So this was just another report. This was from the Royal College of Physicians around advancing professionalism. So again, one of my big interests around professionalism, but certainly over the years, we've noted that there's an increasing gap of what doctors or medical students are trained to do. But then what are the realities of modern day practice? We know there's a shifting context with the aging population, with patients with multiple comorbidities, rising healthcare costs. This is not just in high income countries, I'm sure this is globally. And then the advances in science and technology, but more so the changing in patient and societal demands. I've seen this even in my own context of the demands are changing. And how can we make sure and ensure that our students and our junior doctors are learning the right things? So the remit of the doctor is changing, and therefore we need to change how we educate and how we train our doctors. And being a doctor is not just about being a physician, patient-centered care. We have so many different roles. So this, kind of, as I say, kind of encompasses some of those different roles as a team leader, as a team worker, as a manager, as an advocate for our patients, as well as our students, and as a teacher, all about medical education today. So this is what we want to instill in our medical students, that they are then capable and competent to do all these different things, maybe not to the highest, absolute, kind of leader potential, but that's what we want to create, that potential of learning, and making sure we cover this when we're planning our curriculum and our training programs. So what should be the goals for modern medical education? So we want to standardize the learning outcomes and general competencies, the customizing the learning process. So that's where the personalized learning, so a lot of work around that. And I'm doing some work around individualized learning, developing, kind of targeted needs analysis, individual needs analysis for individual students to then target their learning. And then providing education and, kind of policy, leadership, management, all these things should be taught early rather than waiting for sort of senior training level to then, put into practice. Earlier the better. And integrating these aspects, some knowledge, skills, values, but also those wider things around, managing teams, the innovation, the investigation, as I mentioned in the previous slide. And who takes responsibility? As I say, medical schools, teaching hospitals should all support this environment for that kind of wider systems, teaching and innovation. And then the development of professional values and aspirations, it's backbone of the medical education. So I think those things I feel are really important, and that's in one of the papers that I've shared with you ahead of this sort of session. So the impact on professional development and patient care. So I think if there is much more of a system-based curriculum, that should improve performance and drive performance in healthcare systems and adapting that core professional competence as well. And there's an interdependence in education as well, in how we learn, how we sort of teach, interact, and that promoting much more collaborative approach and patient-centered care and interprofessional learning. So a lot of talk in medical education around interprofessional learning. The organisation I work for with Health Education England is a multi-professional organisation for education. So we drive the agenda for education of nurses, other healthcare professionals, and then there's some parallels between curriculum development across professions, which I think is really important to understand and appreciate as well. So that shift in emphasis over the decades in medical education has been from that informative learning that produces expertise in certain areas, very specific, to that much more formative learning that produces professionals, to now much more transformative, developing those leadership skills, attributes with much more enlightened learning. So I think there is a shifting emphasis in medical education over the past decades. And as a medical educator, what do you want to do? What are the foundation principles of being a medical educator? So you want to embrace the science and instill this passion. I think we as medical educationalists are very passionate, and I would hope that that would then, you could bring that into our learners as well and demonstrate that degree of integrity, thoroughness and expectation from the learners as well. Role modeling, I'll talk about that in a minute as well, is really important. And how do you role model with a degree of honesty, integrity and kindness? I think that's really important, and approaching this in a fair and equitable way as well. Fostering a positive learning environment, that's really important, and developing the next generation, as we said, and demonstrating that focus on that wider good. And that's kind of what you want to instill and take forwards. So the latter few bits is just around medical education standards and quality assurance framework. So quality assurance, super important as an activity, and it kind of ranges across. I'll talk about quality management and quality control. And it includes all the policies and standards to drive the quality of medical education and training. So this is kind of, again, the framework that we use here, which I think is quite nice in the way that it makes you think about the different themes. So this is the Promoting Excellence framework from the General Medical Council for Education and Training. So the emphasis on that learning environment, culture, educational governance, supporting the learners, but also supporting the educators, because we can't just, sort of support the learners without supporting our educators. We need to upskill them, support them, concentrate also on their faculty development as well, and then around curricular assessment and design. And this is just, I'll share all the slides with you afterwards so you can look into some of these things, but it breaks it down into so there's 5 themes and then there's 10 standards which we should be maintained. And this is the kind of things that we do as assessments for institutions to then assess the quality of training and the education delivered to hopefully drive the quality further forwards as well. And who does the quality management and quality control? So here in the UK, and again, different systems in different places, the GMCs are regulators, so they do the wider quality assurance. The quality management, the middle bit, is the Medical Schools Council, which govern all the medical schools. Health Education England, which govern all the postgraduate, bodies, and the deaneries and the local education training boards. And then the quality control is done much more locally. And where does the Royal Colleges sit? So they sit across all of these different, so the quality management is across these 3 domains. And then this assurance framework. So just earlier, I was doing a visit for one of the providers, one of the hospitals. So we set the standards, and then we do visits, whether they're virtually now with COVID or in person, to assess the quality of training there. So whether it's postgraduate training or the medical schools, we then approve them, measured against the standards, and then you have that cyclical monitoring to ensure. And the patient safety is at the heart of all of what we do. And that kind of drives the quality, both for the training, but also for patient care. So role modeling, just finally finishing off with that. So it's hugely important for professional development. And it's the process where faculty members like myself would hopefully demonstrate skills and model articulate the expectations, the processes that manifest positive professionalism. There's the 3 interrelated domains around the formal, informal, and hidden curriculum, and role models influence and teach by example, whereas mentors have more of a formal relationship. So there is a difference between the 2. And I shared this paper with you, which is a systematic review around role modeling in medical education, in which they looked at 39 studies, and these major themes emerged out of that. So positive attributes of role models, doctor role models, and that's being a good clinician, a good educator, but also having positive personality attributes as well of positive role models. But have a read of this, it's really quite fascinating. And that influence of positive role models on student careers, I'd like to think, I mean, a lot of my career was influenced by positive role models over the years. And that's really important as setting examples and what we can do for our students as well. And that process of positive role modeling is around observation, reflection, and then reinforcement. But what about negative role modeling? That could be really damaging as well. So it's understanding that and also providing that support for our students and trainees to avoid that happening. But if that's happened or happening, then providing support for that individual as well. And that influence of culture, diversity, gender. So when I was at medical school, very few female consultants, very few of my background as Muslims and sort of 1st or 2nd generation Asians and things as well. So I think those things are really important with that cultural diversity. And I would hope that over time we can bring that influence in a positive way to our students and our trainees as well. So excellence in role modeling involves demonstration of those clinical competence skills, excellence in clinical skills, and that humanistic personal qualities, kindness, integrity, being that positive, supportive individual. And as I've mentioned, they don't only shape your professional development, but I feel they influence their career choices. It certainly did for me as well. And if there are those negative role modeling challenges, it's important to mitigate early and support the individuals as well. So finally, just to say that certainly my medical educational journey, I've not gone through everything, but has been hugely rewarding and enjoyable. And certainly for me, it's taken unexpected direction, various achievements over the years, and certainly lots of diverse roles that I've talked about today. And for me, it was hugely influenced by my role models and mentors that I had over the years. And I think a great sense of satisfaction in my medical education career of being able to influence and support both at a personal level for my patients, my students, my trainees, but also then at a regional level to drive patient services, quality of training, and on a national level also to improve quality of training for our junior doctors. And then various research that I lead on is around professionalism, assessment, differential attainment, and fairness in education, which I think is really important. And then now in my global role, it has a much greater remit, but that's been an amazing opportunity as well, and working with all of you as well, which is an absolute privilege. So finally, just to say, I hope I covered some of my intended learning objectives here. So I was hoping that I'd cover the importance of medical education, which I hope I've covered, some of the key concepts, and also giving that wider impact of professional development and the impact of medical education on so many different domains as well. And hopefully gave you a little bit of a, the quality assurance frameworks as well, which I think is really important to drive the quality of learning. And lastly, the importance of role modeling, because you all role model, even as a senior medical student to a junior medical student, to your family, to your friends, and more so also as you progress in your career as well. So I think it's really important to understand what makes a good role model, and hopefully you can all do that over your careers as well. So thank you so much for listening. I hope that was helpful, and I hope I was on time. I didn't check the time, Hilal, sorry.
Thank you very much, dear Mumtaz. A very brilliant, as usual, presentation. Really, I very enjoyed your presentation, as if I am hearing a very nice song that's close to my heart and brain as well. Thank you very much, Mumtaz. You address a very critical, important key issues in development and the importance of medical education. And really, there are many points are missing in our countries, and there is no focus on that, on these points. And it's very important to focus on them, at least to stimulate our medical students and junior doctors and even professors that being with us now, to focus on these points, because they are main pillar in the modern medical education. May I ask Omnia to have a couple of questions? We have 15 minutes for questions for Dr. Mumtaz. Omnia, having a question, please.
Thank you, Dr. Thank you, Dr. Mumtaz. It's been a very nice and concise presentation. We have one question from Mustafa Ismail. He says, we have learned what's make a good doctor is knowledge, skills, and attitudes. Medical education, as I understand it from you, should reach morality level in the individual, integrity, trust, etc. My question, how can we teach these moral values within the medical world in the best possible way? Thank you. Yes, Dr. Mumtaz.
Thank you, Omnia. So I guess that's around a question around how do you teach professionalism, professional values, which encompasses integrity and things. So certainly I think we can all do that. So the curriculum itself is the core of what the heart of learning is at the outset. And I think having that framework approach where the professional values are at the core of the teaching. So every single, part of the curriculum should have a component where there is, kind of professional behavior, attitude, which is being taught. Now you can teach that by giving talks, in the different methods of learning. So I always do a professionalism talk at the start of year one for all of our medical students. And that's based on very much the good medical practice guidance that I mentioned around the different domains. I put forward what is important. I get the students to discuss. And I think it's that dialogue, that discussion. So giving a lecture is great, but you need to have that discussion of what makes a good doctor and how can you instill that. So different methods of learning. So professionalism teaching can be done in a lecture base, in case-based discussions. So you can flip it, what makes positive professional behavior, but also what makes it unprofessional. So I have lots of referrals for fitness to practice and other issues. So you can give case-based discussions around professional behavior, particularly around social media and things. We have lots of discussion around that. What makes a professional, what is acceptable as a physician, as a doctor. So it's teaching that and instilling that early, not waiting till you're a doctor to teach this. You should be teaching this early, from early medical school, by different methods, whether it's, delivering of lectures, kind of cases for discussion. And then, like I say, things like role modeling and things, when you're doing your placements on day-to-day, those things can be assessed as well. What is your communication like? What is your level of honesty, integrity, team working skills as well? So making it integral to the curriculum and teaching it in different ways. I hope that answers the question.
Thank you so much, Dr.
Any other question, Ummiya?
No, until now, nothing. Please, if you have any question, you can raise your hand and unmute yourself. You can just
Yes.
post them.
Yes, Hassan Ahmed,
Yes,
please.
Hassan.
Okay, first of all, thanks to all Dr. Hilal and Dr. Mumtaz, Dr. Omnia for facilitating this great course. So my question is, as we learned in this lecture, medical education is a long process that spans many years of the doctor's life, maybe until after his retirement. So the question is, how do you keep yourself motivated and stimulated to pursue better medical education? Thank you.
Thank you. So that's a great question. So for me, it's been around diversification, doing lots of different things. So I always say at the heart of what I do is as a clinician for my patients, but being an educator, I mean, certainly since I've been a consultant, a lot of my roles that I've done have been in medical education because I love teaching the art of what I've learned to others and transfer that and see their progression. Because I know Hilal would probably agree that seeing your students progress, seeing your junior doctors progress, gives you such a sense of reward at the end of it. So that certainly keeps me engaged and inspired and doing different things. So I think in the systems that we work at, you can quite easily get quite down about changes that you're unable to make, management issues, finance issues, all those kind of things. But try and do the things that you can do. We all work hard and making the influence and change in the areas that you can. But certainly in the field of medical education, I feel that, you know, inspiring, teaching others, seeing them grow is something that really, you know, sort of motivates me to keep going. And that you can do at different levels.